guys, and welcome to How to Gastro. In today's video, we'll be talking about a very interesting topic, and that is trichomoniasis. So let's get started. So what is trichomoniasis? Trichomoniasis, also commonly known as trich, is a sexually transmitted disease caused by the parasite Trichomonas vaginalis. The disease is very common and usually affects women more than men, older women more than younger ones, and African women more than white women. So from this definition of trich, we get that it's actually a very common STD, and it more commonly occurs amongst women rather than men. It is also caused by this parasite, which is called Trichomonas vaginalis. And microscopically, this is actually what the structure of this parasite looks like. So now that we know what trich is, let's take a closer look at the signs and symptoms of the disease. So the majority of patients who do suffer from trich will experience no obvious signs and symptoms of their disease, but in a few patients, symptoms may begin and usually appear 5 to 28 days after the initial exposure. So symptoms in women may include abnormal vaginal discharge that may be thick, thin, or frothy and yellow-green in color, discharge and unpleasant fishy smell, soreness, swelling, and itching around the vagina, which cause itchiness, pain, and discomfort when passing urine or having sex. Some of the symptoms that may affect men include pain during peeing or ejaculation, needing to pee more frequently than usual, having a thin white discharge from the penis, and suffering from soreness, swelling, and redness around the head of the penis or the foreskin. So how does one contract trich? So trich is spread through vaginal, oral, or anal sex, and it's important to keep in mind that the disease may be contracted from someone even if they have no signs or symptoms of the disease. So as we mentioned in the previous slide, we said that a lot of the patients are actually asymptomatic or don't display any obvious signs and symptoms of the disease. But that doesn't mean that these patients aren't contagious or they can't transmit the parasite to another individual. They can and actually will. And this is actually how the disease spreads so fast, is because patients don't actually know they're infected. They continue having sexual intercourse and engaging in sexual acts and actually transmit the disease quite easily. So one may also contract trich through close genital contact, and this means you can get trich from someone even if there's no penetration, orgasm, or ejaculation. So we don't just need a form of vaginal, anal, or oral sex to contract the disease, but we can actually contract the disease through close genital contact. So now let's talk about the diagnosis of trichomoniasis. So the diagnosis of trich is done by looking at a sample of vaginal fluid for women or urine for men under a microscope. The trich parasite is very distinctive looking and is easy to identify. And this is actually what the trich parasite looks like under the microscope. We see the nucleus within the front middle area, and we see the distinctive flagella of the parasite. And this is the typical aspect of what it looks like under the microscope. So another way we can diagnose this disease is by growing a culture, and this used to be the way to diagnose trich, but newer, faster tests such as rapid antigen tests and nucleic acid amplification tests, which look for small amounts of the T. vaginalis DNA in the urine, vaginal, urethral, or rectal samples, are actually more common now. So the newer tests actually magnify the DNA of this parasite, and they can be identified from samples of urine, vaginal, urethral, or rectal fluids, and are actually more common and faster now. And finally, let's talk about the treatment of trich. So thankfully, the trich infection is pretty easy to treat. The most common treatment for trich now is done with 1 megadose with either the metronidazole antibiotic or the tinidazole antibiotic. And that brings us to the end of this video on trich. Thank you guys so much for watching. Please make sure to like, comment, subscribe, and share. Hope you found the presentation very interesting and informative. Please make sure you turn on your bell notifications so you'll be notified every time we have a new upload. And if you'd like to download a copy of this presentation, you may do so by clicking the link in the description. Take care and bye for now.